Hello, and welcome to the Pharmacy Times News Network. I'm Nicole Grisano, and your host for our Pharmacy Week in Review. Two new surveys from the American Heart Association, AHA, found that most employees are ill-prepared to respond to cardiac events in the workplace due to a lack of CPR and first aid training, according to a report in the American Journal of Pharmacy Benefits. While more than 10,000 cardiac arrests occur in the workplace annually in the United States, the surveys found that many employers do not offer the training or only offer training for either CPR or first aid. The authors found that more than 90% of employees would participate in first aid and CPR and AED training if it was offered, and 70% believed that the training would make them better prepared for emergency medical situations. When CPR is administered in a setting outside of the hospital, the AHA reports that survival from cardiac arrest can double or triple, highlighting the importance of workplace training. Home-based medication errors are becoming more common, according to reporting from Pharmacy Times. Researchers noted that the rate of medication errors which occurred outside of health facilities and occurred mainly in homes was 1.09 for every 100,000 Americans in 2000, and rose to 2.28 in 2012. All age groups except children under 6 years of age experienced an increase in medication error frequency. In children 6 years or younger, medication error rates decreased after 2005. The researchers noted that this was likely attributed to decreased use of cough and cold medicines in this age group. According to the study, the most common errors were associated with cardiovascular drugs, 21%, analgesics, 12%, and hormone antagonists, 11%. Cardiovascular and analgesic drugs were the cause of most fatalities due to drug errors. Reasons for medication errors varied from being prescribed the wrong medication to having the incorrect dosage measurement. A report in Specialty Pharmacy Times suggests that residential radon exposure increases the risk of malignant melanoma. Radon is an odorless and colorless radioactive gas that causes an estimated 15,000 to 22,000 lung cancer-related deaths per year. It is the second leading cause of lung cancer in the United States, second to cigarette smoke. For the study, investigators analyzed 1,900 deaths caused by malignant melanoma between 2000 and 2008 in Switzerland. Radon exposure was modeled based on 45,000 measurements and accounted for the housing characteristics and the geological conditions of the area. The findings showed that the relative risk for skin cancer among 30-year-olds increased approximately 50% per 100 becquerel per cubic meter increase in radon exposure, compared with only 16% among the 60-year-olds. Appropriate house construction can help significantly reduce residential radon exposure, the authors noted. Pharmacists may receive more questions about syphilis, as the CDC recently posted an informational video on this topic on their YouTube page. The video notes that syphilis rates are increasing, even increasing among newborn babies. The video urges healthcare providers to talk, test, and treat patients using long-acting benzathine penicillin G-IM and advises healthcare providers to advise patients to tell their partners. For more great coverage and practical information for today's pharmacist, visit our website and sign up for our daily e-news. And don't forget to follow us on Facebook, Twitter, and Instagram. Thanks for watching our Pharmacy Week in Review. I'm Nicole Grisano at the Pharmacy Times News Network.